Hello and welcome. This is Health and Wellbeing, and I am Lois Apasambo. Following the relaxation of some COVID-19 restrictions, citizens are beginning to move on from the issue of the pandemic, which raises the question, is the pandemic over? Our guest today is Dr. John Oladejo. He is the Director of Health Emergency Preparedness and Response Department at the NCDC. Dr. Oladejo, welcome to the program.
Thank you very much.
And it's nice having you here.
Thank you.
It's going to be a very interesting discussion because we're going to be talking about how prepared we are we're going to be talking about how prepared we are for future occurrences or future outbreaks such as COVID-19 and how we are taking the COVID-19 pandemic, because we know that when the pandemic started, there was a lot of hiatus. We didn't know where to start from. We didn't know what to do. And it was a big deal for us because for the whole world as well, because it was a new kind of disease. And one of the major things that happened during the COVID-19 pandemic was we are all looking out for a solution because there was no solution. Now, we're thinking we needed a vaccine. So many international organizations were saying, once we get a vaccine, things will get better. We'll be able to go back to normal. And we have a vaccine. It's 2 years now down the line. And a lot has happened. But we're beginning to see a relaxation of COVID-19 protocols and restrictions. And it makes us wonder, is the pandemic over?
Thank you very much for this particular question. As a matter of fact, we will not say it is over yet. In the midst of so many things happening, the insecurity, the international conflict and everything, we still have COVID-19 around us. The only thing is that the number of cases have actually declined tremendously, and which shows that we are actually winning. It is not yet over. As a matter of fact, if you look at our statistics in the last few weeks now, you will see that the number of new cases that are just coming up were just very minimal. As at today, we have only 22 cases, new cases, unlike before, where you have 500, 1,000, and so on and so forth. So there has been a lot of decline in cases, and this is as a result of our active management of the cases all over the country. As a matter of fact, you know that initially when we had the cases, we had only 5 laboratories that can actually diagnose. But as we speak now, we have over 140 laboratories. This is one of the great things the government have actually done by providing the avenue for private laboratory to be part of it, and then our partners in country too. So we have what we call EOC, that is Emergency Operation Center, where we meet regularly to discuss what is actually going on in the country. And as we speak now, we're on level 2. Initially, when we first started, it was level 3. But when we realized that the cases are coming down and people are actively working on the field, it was actually brought down to level 2. And so we are managing the cases at level 2 as a result of the low number of cases that are coming in. Not that we are not testing. We are testing every day. But the number of cases, new cases that are coming in are low, so we have to look at that. So, which means we are actually winning the battle.
Well, it's great that we're actually winning the battle. Well, we're going to go on a very short break, and when we return, we're going to talk about more cases. We're going to talk about why there is now a relaxation of some of these protocols, and if, just like you said, the pandemic is not over, why are we reducing or relaxing some of our protocols? But that'll be when we come back from this short break. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we will realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for joining us. If you're just joining us, this is Health and Wellbeing, and I am still here with Dr. John, and we've been talking about, is the pandemic over? Discussing why there are relaxations of some restrictions and the way forward for us to the COVID-19 pandemic, and looking forward what Nigeria can do in further outbreaks that might hit us. So like I said before we went on the break, I said we're going to discuss why are there now relaxations of some of these restrictions if, in quote, the pandemic is not over? Because one of the major issues we had, or one of the major things we had to propagate, was we had to take responsibility. Some of these restrictions had to be enforced because we were trying to contain the spread of this virus. And most especially for Nigeria, where at this moment we have not reached our 70% vaccination status, and to be able to get herd immunity, but we see quite a number of restrictions being relaxed. Why?
Oh, okay, let me quickly just give us the updates for this COVID-19. As at today, 19th of April 2022, today we have 255,670 cases confirmed, and then we have 249,879 cases have been actually discharged, and we have 3,143 deaths recorded in 36 states of the Federation, including FCT. But as of this morning, we have 22 new cases reported from 4 states. 4 states out of 36.
Yeah.
So we have Lagos 10, Nasarawa 6, FCT 3, and Rivers 3. As a matter of fact, you can just see that we are working up actually to scale up COVID-19 testing all throughout the whole country. And this, as we are actually testing, we saw that we are having decline in the number of cases. So when you look at the number of cases, we don't just propagate any restriction anyhow. We have to look at the data, we have to look at the science. So we follow science to do whatever we are doing. So you can't just wake up today and say, oh, these people, they should not do this, they should not do that. So we follow that. So for ease of restriction, by going forward, we saw that the number of cases was actually declining, and the people that are being infected, they are not as much as we are having before. So we have to ease the restriction to ensure that the economics is being picked up, and then the social services are being given as such. So we follow science to ensure that we we ease the restriction, and then we continue to scale up to ensure that we have what they call variants of COVID-19, to ensure that we don't have that variant, or we have it minimal in the country. So, for example, now, initially we have only 1 or 2 laboratories that can actually sequence COVID-19, but we now have more than 10 that can do that. So the number of sequences we're getting now that are positive to the variant, they are very, very few. So in view of that, we are actually, is the restriction as the case is.
Well, like I said earlier, we're yet to reach our mark of number of people who would like to see vaccinated. And, even with the onset of the vaccine, there was vaccine hesitancy, a lot of theories that was
Yes.
associated with the vaccine. And with these restrictions, it may tend to make people feel like, okay, everything is okay. I don't need to get vaccinated. I don't need to, but does this actually spell an impending doom for us if we're not able to reach this herd immunity?
No. I told you that we are always following science. We can't just ease restriction without any cause. So it is this science that we follow that makes us to say, okay, let's let's ease the restriction. But we still have to tell our people that we still need to wash our hands. We still need to use face masks in a closed place. It's optional when you are in an open space, and you continue to wash your hand every time to ensure that you don't have any germs in your hand that will cause any disease. But it is not only for COVID-19; it's for other diseases, because we realize that if you wash your hand regularly and you ensure all the respiratory etiquette, there are some other diseases that you are actually preventing. So we still tell the public that please don't just ignore all the necessary protocol. You still have to continue with it. You will see me that when I was coming in, I used my face mask and ensuring that I don't, I prevent myself from being infected. So all these are still going on. We are still sensitizing, we still sensitize people. We still go to the television like what we are doing now. We go to radio stations, and then we go to the local level with different messages from our risk communication experts to ensure that people still abide to all these protocols. But we also have to restrict it. To ease the restriction as a result of the science we are actually following to get all these things done.
Now, talking about science, I remember in the heat of COVID-19 and when it started, I think Bill and Melinda Gates actually gave a projection of how it was somehow going to be for Africa, how most especially, with the COVID-19 pandemic, it showed how so many health systems were not as strong as we thought they were.
Yeah.
And most especially for us in Africa and down here, we know that they're not so strong as well. But we actually saw a difference in what was projected for Africa. And there was a projection that Africa was going to be so hit by COVID-19 and we may not be able to survive it and all of that. But we're here, I think almost like the strongest continent in the world that I was actually to hold up to COVID-19. We're even coming to find out what it is. Now, talking about science, is there a scientific research or study that explains how Africa was able to hold up?
Initially when this COVID-19 started, they were thinking that our infrastructures were bad. Our hospital systems were nothing to rant home about. But we were able to, stand to the fact that we can face this reality. So the first thing we did during the period was to set up what we call technical working group, comprising of the ministries, the departments, partners, and NGO. And we have different pillars, including research pillar. And in fact, this research pillar has now metamorphosed into a research colloquium that are really working very hard. You will remember that on the 26th of March 2022, Lancet was actually commissioned in Nigeria, and that is the apex of the research. We have all our partners and everyone that are working day in, day out in the laboratories and everywhere to ensure that we have the best management of this COVID-19. So these are the things we actually put in place. We are using incident management system, and we are using EOC. So all these infrastructures were actually put in place before we now had the first case in 2020. So what we did was that we were putting all the necessary infrastructure in place within the period when we had that we had the first case in Wuhan in China, till the time when we now had the first case in February 2020. So we were having meetings with all our partners, and government was able to put down some money to ensure that we were able to look at our infrastructures and put all the necessary machineries in motion during the period. And we're still doing it even up to now. I told you initially that we had only 5 laboratories initially, but we are now having more than 140. So these are the things that really help us. Initially, we were only testing few samples, but now we are testing a large number of samples. We are using RDT, we are using PCR. These are the new innovations that were put in place that made us to be able to really conquer it. And our risk communication, as well as the media, were really doing a very good job. They were going into the community to be able to give them all the necessary messages that they will need to be able to keep themselves away from these diseases. And the lockdown we had really helped us in that period, because it really reduced the number of new cases for over 1,000 being reduced. That will have caused a lot of and then we have special immunity, which I would say that really helped us, because as people were actually being infected, after treatment, they were able to go back to their houses, unlike those people that were infected outside the country, in Europe and America, So the severity may be as a result of our environment too, because this is a tropical area, and then the ability for us to cope with diseases. We have so many of these infectious diseases that are ravaging the country. Lassa fever, this and that. And this is not a new thing to our system. And that was the reason why people that were infected were able to come out of it within a very short period of time. So all this, with government efforts in providing the necessary infrastructures, building treatment centers in each of the states. It was a very huge financial obligation which government was able to meet. And then we at NCDC were able to train all our health workers, even the health workers at the state level. We are training them. We trained over 50,000 within a very short period of time to be able to cope in terms of treatment, in terms of infection prevention and control. And then we were able to have our RRT in each of the states. So we were able to deploy more than 47 RRT, comprising of about 10 different experts to each state. And we're even giving them vehicles to move, and then medical countermeasures, deploying commodities, deploying medicines to all these states. So all these things are the ones that really made us to stand out among all our colleagues all over the world.
So it's safe to say that scientifically, somehow, Africans have a better immunity.
Yeah. Apart from that, we have experts that were able to unravel this novel virus within a very short period of time. And we were able to follow it scientifically. People were researching, as we were treating, we have a group of people that were actually doing some research. If you treat this way, they do some research, they say, okay, let's move this way again. So those things are really helping us to be able to stand out.
So it's 2 years, and I know that since the COVID-19 pandemic, what have we learned as a country concerning the COVID-19, the pandemic, and how we can actually make our health systems better?
Oh, we have learned a lot. We've learned that preparedness is the key in whatever that is happening. You don't allow a pandemic like COVID-19 to happen before you start preparing yourself. That is the major thing. Every other thing is attached to it. The building of our treatment centers. We don't have more than 2 or 3 business centers. But now each state has its own treatment center fully equipped with modern equipment. So these are the things that we're able to do within a very short period of time. And that if there's another pandemic, we know that we'll be able to, treat it immediately and then be able to contain it within a very short period of time. It will not take this much because people now understand what they should do in terms of infection prevention and control, what they should do when they have any symptom, what they should do when their neighbors is actually coughing or doing this and that. So all these things are some of the things we really learn. And that if this globe is the one giving us light in this environment, we should ensure that before this globe now burn out, we should have another one. So we have had different type of committee in that area that are actually monitoring this and ensuring that things are put in at the right place at the right time.
So one of the major things that kept ringing during the pandemic is genomic sequencing. And for the layman, he may not know or understand what genomic sequencing or surveillance is. Well, we're going to go on a short break. When we return, we're going to talk about genomic sequencing and how it has affected or how it has impacted Nigeria's healthcare system. Do stay with us. When we come back from this short break, our discussion will continue.
Thank you.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. This is still Health and Wellbeing, and I am Lois Abasambo. I am still here with Dr. John. Before we went on the break, I said we're going to talk about genomic sequencing or genomic surveillance. And like I said, during the pandemic, one of the things that constantly came up was doing genomic sequencing and all of that. Before we go to the main questions, please, can you break down in layman's terms, what is genomic sequencing?
Well, let me just try because this is...
It's very technical.
Yeah, it's very, very technical. When you are talking about genomic sequencing, you are talking about what are the makeup materials of the virus that is causing trouble. We call it genomic makeup. That is, what are the when you look at the virus, it's very tiny, but it still have some other materials that make up of it. So we really want to know what are these genomic makeup that are actually causing the problem. We call it the variants. The first thing is that we have COVID-19 virus. Then COVID-19 now starts mutating. That is, as a result of one thing or the other, it just changed shape, change how it's formed, and then it's now formed another variant, like Delta variant. Sometimes something will happen to it, then form another variant, then we call it Beta variant, and so on and so forth. So those things that now form is what we now say, let's see what it forms. So we have a variant of concern, we have variant of interest, but our own is variant of concern. Those ones that will cause disease, that will cause one to be sick, is the variant of concern, and one of it is Delta. So this Delta, how do you know that this particular case is a Delta case? You have to take the sample after knowing that it's COVID-19. You now have to take part of that sample to another specialized laboratory where they will now do a breakdown of that virus. As I do the breakdown, you see different markers. If you have seen it before, the different markers, it will now show to us, oh, this man that have COVID-19, that COVID-19 he has is Delta variant, is Alpha variant, is Omicron variant, and so on and so forth. So our scientists now go further. Which ones is really causing a lot of trouble? Which one is causing real disease and death? So you see that of all the variants, because we have different types, is Delta. So how do we now ensure that this Delta variant is being disrupted from being transmitted to community? That is transmission of to the community. So they will now find a means. Okay, this is variant of concern, this Delta. So what do we do? So these are the things we need to do. So we need to let the community know. We need to let the public know that we now have another variant of COVID-19 that can cause problem in the country or in the community. And this is Delta variant. And this is what I expected to do. This is what I expected to do. So genomic surveillance or sequencing is a specialized laboratory analysis of COVID-19 in such a way that we'll be able to know the type of variant we have that is actually transmitting diseases in a particular community.
So now that you've broken this down, before the pandemic, Nigeria's, I don't think we had so much a strong genomic surveillance. And whether to say it was good or bad, it actually help us build our genomic surveillance now. And the World Health Organization has actually published a strategy for genomic surveillance, and not just for COVID-19, but for other diseases, Ebola, we could have so many other diseases. And this strategy actually covers quite a lot. But one of the things that I would say, one of its objectives I would like us to talk more about is being prepared for future outbreaks.
Okay.
How is Nigeria tapping into this strategy to make sure that we are prepared? And most especially because in Nigeria, like you said earlier, we have quite a number of diseases, which actually does help our immune system. But, you know, we have Ebola, we have cholera, we have Lassa fever, quite a number, and it's a lot for us to deal with. Now, how is Nigeria tapping into this strategy to make sure that we're able to contain such outbreaks? And if there is ever going to be something new like COVID-19, we're going to be ready for it?
The first thing is the workforce. Strengthening of the workforce, very, very key. Because if you don't have people that understand infectious diseases, that are experts in this, you cannot do anything. So the first thing we did was to train as many people as possible in this particular area, or infectious diseases generally, so that they can handle any of those diseases. So we have actually tapped into that. You know, initially we didn't have more than 300 field epidemiologists initially. We were having more than 5,000 field epidemiologists. And we want to meet that level where we will have one field epidemiologist per 400 populace. And we have already had a plan on that, and we are working on it. So we have reached halfway. So in the next 1 or 1.5 years, we'll be able to reach that level. So if you have a workforce that anytime you tap your computer and you see somebody in a particular village who is a field epidemiologist and they're having a problem there, all what you need to do is to ask the person to start acting. Not that you have to send somebody from
another state or another place.
Abuja to Maiduguri. No. So in every of the local governments, in every of the states, we must have a network of field epidemiologists there. And that's exactly what we are doing now. And that is major lesson we have learned. Because sometimes, because of the insecurity or anything, you may not be able to travel from FCT to that place. But if you have an expert already there, you don't have any problem. That is it. Then another thing is the industry. You know, most of the things we are using, like face masks, like hand sanitizer and all those things, some of it we have to import. But now we are having investors that are actually producing them here. That was how Ghana was able to make a lot of money from just ordinary face masks. No, Kenya, face masks. So you can make a lot of money because people will come from outside the country to come buy from you. That's another foreign honey. So some countries made a lot of foreign currency through this COVID-19. So when it was a bad thing for some people, it was a good business for others. So this is another area. So Ministry of Industry is actually working with the Manufacturers Association of Nigeria, with NCDC and Federal Ministry of Health to ensure that we have all those industries ready. We don't need to have another pandemic before we now start thinking about that. So it was one of the key things. Then another area, at the communication. So we, during that period, were able to bring all the media houses together and were able to tell them these are the things that are happening, and we continue to sensitize them every time, so that when they get to the grassroots, to the community, they will know what to do. Then another thing we are doing was to really get our philanthropists at the local level, because most of these our people, they don't listen, but when they see the philanthropists, they see the traditional rulers, they listen to them. So we actually hold meetings with them regularly, and we believe that with this, even other infectious diseases that are ravaging the community will be a thing of the past as we go ahead. Then, building of treatment center. We realize that each state must have a treatment center where all these highly contagious diseases can be treated. And we have started that. We have done it in about 18 states, and we're doing it in the remaining 18 states plus FCT. So within now and the ending of next year, we'll be able to complete that. So those are the major lessons we really learned, and that we are not going to be waiting for any pandemic to strike before we put a stop to it.
Now, with all these things that we have learned, I know that there is always, most especially for Lassa fever, because we're also, and cholera as well, we're also still battling with this in the country. How has genomic sequencing now helped us to be able to tackle this that we're still dealing with?
Yes. I told you that initially we have only one specialized laboratory, but now we have about 10 that can do that. And we want to have it in all the strategic states. The reason why we need genomic sequencing is for us to know what are the variants that are actually ravaging that particular community, that are actually in transmission, that are actually causing the disease. So that when you know that, then you'll be able to now strategize to be able to contain it within a very short period of time. If you don't know what you are really dealing with, it's COVID-19, and you are using all the necessary treatments and everything, and the thing is not subsiding. But you still know that it is COVID-19. So there's something that is there, because when you are just treating it as a COVID-19, you may be treating it for 45 days. Whereas when you know the actual variant of concern there, within 7 days, the person will be all right. So you can see the difference. You know the reason why we need to have as many as possible of these genomic laboratories where we can do genomic sequencing, where we can diagnose within a very short period of time. You don't allow time factor. Within a very short period of time, when you take a sample, quickly take it to the lab, as I confirm that it is COVID-19, then you quickly run the genomic sequencing and know which of those variants that are dominant. That is the importance of it.
Well, thank you very much, Dr. John, for taking our time to be here with us.
Thank
we
you
sincerely
so much.
appreciate your presence. Before we round it up, so far now in the country, how many genomic sequencing laboratories do we have now? From, let's say, from when we started COVID till now, how many do we have?
We had one initially when we started, where we now have 10 now. But from federal government, we are still, in fact, by ending of this month, supposed to have up to 20 because there's a plan in place. But for now, it's only 10.
Okay. Well, thank you very much, sir. We
Thank you.
sincerely appreciate your presence. Before we round it up, can you please give us a word of advice to our audience out there?
Okay. As a matter of fact, COVID-19 is still around us, though we have very low cases, but notwithstanding, I still want us to use all the necessary protocol, wash your hand regularly, still use a face mask if you are in a enclosed environment. Even when you are in an open environment and you are so many, still use your face mask. And I believe social distancing is still very, very important, because those are the things that can really make us to break the chain of transmission of COVID-19. Thank you very much.
Thank you very much, Dr. John. Thank you so much for
Thank
taking
you.
our time to be here with us. And we hope the next time when we call, you'll still take our time to be here with us.
Yes.
Thank you very much.
Yes.
Well, that's how far we can take on the program. Do remember that the pandemic is not yet over. So keep taking responsibility for yourself and your loved ones. Keep it a date with us. Same time next week. I am Lois Apasambo. Do stay safe.